Live from the Scripps Studios, this is 10 News.
There are now 734 local cases of COVID-19. Good evening, I'm Kimberly Hunt. Today's numbers represent a jump of 131 cases from yesterday. There are 136 people being treated in hospitals, 56 of those in ICU. The county has also confirmed 2 more COVID-19 related deaths. That brings the total confirmed number of deaths to 9. Another big indication that students may not return to their classrooms this year. Tonight, State Education Superintendent Tony Thurmond said it appears campuses will remain closed for at least the next few months. The decision to keep students away from campus is up to the districts, but the state is now urging them to implement distance learning for the rest of the school year. Many local districts are already working on that. Mayor Kevin Faulconer says it's time for San Diego to step up to protect grocery workers. Specifically, he says we should use credit cards instead of cash, leave as many family members as possible at home, and spread out when we get inside the store.
Most stores are really facing a major surge in demand, so everyone is working harder than ever to stock the shelves ahead of the next wave of customers. And as a result, they're putting themselves in greater contact with individuals throughout the community.
I've had many workers reach out to me in the last 2 weeks that the stores are being overcrowded and there's no way they can socially distance themselves. This has to stop.
City leaders also urged stores that aren't already doing so to shorten their hours to give workers the sorely needed time they need to restock and sanitize. Meantime, the County of San Diego is announcing its own plans to help deal with the rising number of COVID-19 cases. 10 News anchor Lindsay Pena shows us how our area is preparing for a potential shortage of hospital beds.
As the number of coronavirus cases continues to rise, the state of California and the County of San Diego are preparing for a surge. Today, Supervisor Nathan Fletcher revealed a plan in the works to use vacant dorms on the University of California San Diego campus to house COVID-19 patients.
We will take this empty dorm because there are no students there. We will create an alternate care center. This will be staffed with a combination of nurses along with potential telemedicine connection to doctors.
The idea is to use 200 to 250 dorms to free up space in hospitals. It would house people who are well enough to not need serious medical care, but who shouldn't go back home yet.
And we are working diligently to identify the supplies, create the protocols and procedures, along with lining up our medical personnel to stand up this operation.
At this point, it's not clear what building would be used or when the facility would open. Meanwhile, San Diego is also one of several California cities picked to have an Army field hospital.
Now we have identified all 8 field medical stations and their sites from Shasta to Butte County to San Diego to Contra Costa County to Riverside to San Mateo County to Santa Clara and LA County. That's 2,000 bed capacity. We'll get the National Guard building those out, working with the Army Corps of Engineers. I said yesterday they had already had 19 site inspections. They're up to 24 now, and we'll be making some announcements about partnerships with them in the coming days. We're doing all of that because we're not out of the woods. We're doing all of that because we have the time to prepare. And that was the whole point of moving early on physical distancing. There is no regrets in the state of California on our protocols on physical distancing. The only regret we will have if people cut the parachute before they land.
County authorities say there are still several sites being looked at by the Army Corps of Engineers. Lindsay Pena, 10 News.
And starting tomorrow, the convention center will temporarily house some of San Diego's homeless. The goal is to prevent the spread of coronavirus among our region's homeless population and help people find permanent housing. Groups from the city's bridge shelters will be the first ones to move into the convention center. Golden Hall will also help shelter homeless San Diegans. Coronado beaches will now close on weekends in response to the coronavirus. The Coronado City Council voted on that decision earlier tonight. Most of the beaches and the parks in San Diego County are already closed to prevent people from gathering, but Coronado, Torrey Pines, and Oceanside do not have hard closures. Everyone on board this cruise ship docked in San Diego is being told to self-isolate. It comes after a handful of people on board tested positive for coronavirus. The test results come after passengers disembarked the ship and the cruise line insisted no one had shown symptoms. 10 News reporter Anthony Pura spoke with the family of an infected passenger, raising serious questions about how the situation was handled.
Before the nearly 2,500 passengers disembarked a Celebrity Eclipse cruise ship, the cruise line made clear there was no one on board that showed symptoms of coronavirus. But Pete Nystrom says there was at least one passenger that did, his stepmom, who was on the ship with his dad. She is the passenger that has tested positive for COVID-19.
I think she started feeling sick around the 25th. The 26th, I believe, was when she went to the infirmary.
Nystrom says his stepmom went to the infirmary not once, but twice. The second time, she had to be hooked up to a device to help her breathe.
She was definitely fighting for her life at that point. My dad's emails at that time were getting progressively worse and saying she's in really bad shape and he's really scared.
Royal Caribbean, the parent company of Celebrity, maintains no guest or crew members reported symptoms while sailing. County health officials say they were notified before the ship came in that one passenger had a heart ailment and possible pneumonia.
I can't imagine that these doctors didn't know that these are all signs of coronavirus. I mean, as he's writing us, we all know it. We're watching this every day on the news and seeing that these symptoms match up perfectly for it.
Nystrom's stepmom was taken off the ship by ambulance before the other passengers were allowed off. He says it was hard to watch the events unfold, knowing many could be infected.
Kind of getting more and more amazed as the time went on, hearing from my dad how much worse it's getting, that it's basically looking exactly like coronavirus, and still seeing in the news, everyone's in excellent health. We'll be letting them off the ship.
His stepmom is in the hospital in serious condition. His dad is self-isolating in a location given by the county. 3 crew members have now tested positive for the virus. They are also self-isolating. Everyone else that was on the cruise ship has been asked to do the same when they get home.
I'm hoping that they take the isolation and quarantining seriously. We are not in a great place by them all getting off that ship and heading home. And they need to think about that and take precautions.
Anthony Pura, 10 News.
We have been pressing Royal Caribbean for clarity on this issue all day. A spokesperson says they're looking into it. All passengers are expected to be off the ship by midnight. A retired doctor who spent decades saving lives in Encinitas is rising to the governor's call for more help on the front lines. And 10 News anchor Steve Atkinson spoke with her about her determination. Steve, she's just getting back on her feet after recovering from the coronavirus.
And ready to get back to work too, Kim. As you know, Governor Gavin Newsom made that plea yesterday to recently retired medical professionals to come back to the workforce in this fight against COVID-19. Well, I spoke to her. She is going to do just that right after she gets over her own bout with the virus.
81% of people get a mild form of this disease. I'm one of them.
That's Dr. Eileen Natuzzi after 16 days of self-quarantine from coronavirus symptoms. She retired in November after 25 years as an acute care surgeon in Encinitas. But she spends her time now in the Solomon Islands, volunteering her services in underserved communities. It was just over 2 weeks ago when she felt her symptoms coming on.
When I was returning from working in the Solomon Islands, I started experiencing some chills, a little bit of a fever, and just a slight cough.
She flew home a day early and got progressively sicker with nausea and intestinal issues. She spoke with a friend who's an infectious disease specialist and 2 ER doctors.
And they said, well, it sounds like you have it, but you're probably not sick enough to need to get tested at this point in time.
Dr. Natuzzi was never able to get that test, But as of this week, she's back on her feet and recovering. And when she's healthy enough, she'll answer the governor's call for retired healthcare workers to return to the job in the fight against coronavirus. For now, she's helping some friends in Hollywood with their cause.
Please, please donate as much or as little as you can. Everything helps.
That's Dr. Natuzzi's friend, Alicia Silverstone, on her Instagram page this week asking for donations to a GoFundMe created by her fellow actor, Edward Norton. It's already raised close to $5 million to get critical supplies to medical professionals.
To donate money to actually literally cover the cost of moving PPE supplies to locations that need it.
Places like New York, where supplies are desperately low. Dr. Natuzzi has a family member who works in one of those New York hospitals where mass supplies are so short, they use the same one all day.
Here we have sort of a probably more broadly spread disease, and we have folks reusing masks that shouldn't be reused.
Supplies needed everywhere right now, especially in New York City. And Dr. Natuzzi recommends if you too have one of these mild cases of what you think is coronavirus, don't go to the hospital right away or the emergency room. Telemedicine with your doctor for right now, and leave that those hospital rooms for the doctors for the people who have really very serious cases right now. Kim, back to you.
And she's going back in to help. Incredible. Thank you, Steve.